Welcome everyone. Before going into anything or what this is about or why we're all here, just definitely want to lay out first that this meeting will have simultaneous Spanish interpretation. And as a participant, if that is something you choose, you will need to choose a language, either English or Spanish, to listen in Zoom. If you do not choose a language, you will not be able to hear the presentation. So it's important that you do that. And just some of the instructions around that is in your meeting / webinar controls, click interpretation, click the language you like to hear. And this is also optional to hear the interpreted language only. You just need to click mute on the original audio. So those are just some of the instructions for our interpretation options. And yes.
Angie, would you be able to interpret that into Spanish for us before we switch to the languages so people know to choose Spanish if they'd like?
Yeah, do you is that it's going to be translated or is
she's on the other channel?
Okay, she's on the other
moment.
channel.
Yes.
Okay, cool. So I guess
Go ahead, Jamal.
all right, sorry, I don't know if we were working out some technical difficulties or not, but sorry about that. So cool, I think it's working now. So we'll just continue on. So definitely welcome everybody. Welcome to the Community Health Workers for COVID Response and Resilient Communities, also known as CCR in 2109. I'm sure you all have heard that many, many times, the rapid assessment results. And we're, the whole team, all of us are excited for today and grateful for the opportunity to be in community with you all. Just before we start as well, my name is Jamal. I am a trainer with the Envision Equitable Healthy Communities Training and Technical Assistance Center. I'm currently located in Milwaukee, Wisconsin, where I do have deep roots in the community doing CHW work. Most of my CHW work was in LGBTQ plus health promotion and anti-violence advocacy and equity, as well as sexual health education. And the Envision team and our partners are super excited to have the opportunity to be working alongside all of you here. So welcome everyone. And just before we get started as well, I'm just gonna go over some of our operating agreements. I just wanna highlight some of that and set up, just some of the learning culture that we want to create. So first, complexity. There are multiple truths, and a truth is not the same as the truth or the only truth. Curiosity, we lean into what we don't know and struggle together. Voice, participate thoroughly and make space, and consider wait. Sometimes the acronym of wait, why am I talking as well, and also non-closure. That we will go where we need to go and be where we need to be. We can offer first drafts and build from there, and there will be many starts to the conversations and ideas that we want to continue, and that's okay. And if we don't finish today, that is okay as well. And just some of the basic Zoom agreements as well, which we're all probably used to hearing. Of course, stay on mute when you are not talking. And when you are talking, please say your name so we just know who you are and maybe where you're coming from and things like that. Turn on your video if possible or comfortable. We also know that being zoomed out is a real thing, and most of us are in meetings all day. So it is no judgment if you are not able to come off of Zoom. Also use the chat box for questions that we will get to at the end specifically. And I think, there are some spaces in some of the presentations where there might be questions at that moment, but you can definitely use the chat box or come off mute if it does call for that. And yeah, and do what you need to do to take care of yourself. As we know, there's a lot of things going on. We live in a COVID world, we live in a Zoom world. So definitely take care of yourself when that is needed. And yeah, and just today's agenda, we're going to give an overview of Envision, as well as the rapid assessment results, Envision, training and technical assistance. There'll be time for questions, like I mentioned earlier, and then we will wrap things up. So before we get into the presentation, just a quick overview of who Envision is. The Envision CHW Training Center, also known as Envision, is composed of community health workers and community health worker allies who work together with financial and administrative support from the CDC to elevate the role of CHWs. Envision supports the CDC recipient organizations and the CHWs they partner with to address COVID response in resilient communities, also known as CCR, to develop for CHWs by CHWs. And this 4-year project encompasses the CHW movement as a whole and trains and supports CHWs and, concentrating on capacity building and sustainability of a strong, capable CHW workforce. So that is a little bit about Envision. And now at this time, I am going to hand it off to go over the rapid assessment results, Ashley Wernstrom and Catherine Haywood. So let's welcome them.
All right, thanks so much, Jamal. Really appreciate the setup. Hi, everybody. I'm Ashley Wennerstrom. I'm based at LSU Health in New Orleans. I'm very excited to present to you today the results of our rapid assessment. So I'm going to start with just a quick kind of overview. The reason that we wanted to do a rapid assessment, trying to figure out where everybody was, is that when we started this project, we knew if we were going to be providing helpful training and technical assistance to 68 different programs across the country and across tribal nations and various territories, we really wanted to know kind of where everybody was in terms of starting out. Again, really wanting to make sure that we were tailoring our work to the needs of 2109 programs. So what we did was we distributed our survey to all grantees online in December of 2021, both in English and in Spanish. Many of you who are here today probably spent a lot of time completing those surveys, and we're very grateful to you for doing that. We asked teams to complete the survey together so that we were making sure we were getting sort of a complete picture of what's going on within the different partners who are working in any given program. A total of 64 out of 68 of the grantees began the survey and 60 completed. So thank you so much to all of those of you who completed your surveys. I know they were a little bit longer than we had hoped, lots of questions, but super helpful. And then we also did some interviews, which we'll talk about in just a moment. I am going to pass it over to my colleague, Catherine Haywood, if she's here, to talk a little bit about the first piece of our results. Catherine, did you make it? I'm thinking that means no. Okay, that's all right. She's had some other stuff going on today, so I'll just go ahead and jump in. So one of the things that we asked about was whether organizations have received CDC funding previously, just to kind of get an idea of how familiar folks were with CDC processes, and just a lot of the things that are sort of unique to CDC funding. And almost 3/4 had received funding from CDC before, so we were excited to see that. We were also really curious in terms of people who are administering the programs, how many had ever been a CHW themselves as opposed to having just worked with CHWs. And we found that about 90% had not been a CHW. So we felt like that was a significant it's significant for our understanding of how we can, best support programs, and just knowing that folks haven't necessarily had the lived experience of working as CHWs themselves. We also asked about all of the different roles that CHWs would be playing in the 2109 program. And we asked about the roles that are outlined in the Community Health Worker Core Consensus Project, which I'm sure many of you are familiar with. But for those who are not, it's sort of a national consensus on CHW sort of core roles that they do, regardless of what type of agency they're working in or what type of health focus or community focus they may have. So what we found, just overall, I'm not going to bore you to death with every single percentage on here, but what we found was that overall, most programs endorsed that CHWs would be participating in culturally appropriate health education, and really the vast majority, 98% of programs, and also expected to have CHWs conducting outreach, doing coaching and social support, doing things like care coordination, case management, and advocacy for individuals and communities. The numbers reduced just a little bit when we got down into some of our other topics. So we found that only 71% of programs thought that CHWs would be involved in doing things like individual and community assessments, and just about 3/4 said that CHWs would be involved in participating in evaluation and research. We also asked some questions about whether organizations that had received 2109 funding had ever had CHWs within their organizations before. We found that about 19% had never hired CHWs before at all. So some of you all are very new to working with CHWs, which is exciting. And then on the other hand, some organizations, over a third have been working with CHWs for 10 or more years. So a lot of great experience there that we really want to be able to draw from as we're thinking about programs learning from one another. We also asked about just some very specific types of help that folks would want for their programs. And we found over 2/3 wanted just some sort of simple information about community health worker core competencies and scope of work. And similar percentage were interested in having information about how to really ensure that community health workers are trusted by the communities they serve. And then a decent amount of interest in having interview questions for hiring CHWs, as well as job descriptions. So just kind of some of the basics. Also a little bit of interest in information about how to identify effective CHWs. So almost 60% of folks were interested in that. We asked some questions about who would be supervising CHWs, because we want to make sure that we are attending to the needs of supervisors as we're thinking about providing our technical assistance and training. And so we found that roughly a third of folks who will be supervising CHWs are CHWs themselves. The next sort of greatest response was other please describe. So these were folks who had a wide variety of roles in administration, things like social work. It's kind of all over the map. And then almost a third of folks identified as a program manager. And then we also asked about what kind of experiences CHW supervisors have had. Just about a third said that they've been trained on CHW supervision. A little over a quarter had worked as a CHW at some point. And then we also had a pretty large percentage of folks who were unsure. And part of the reason for that is, this assessment was done back in December, and a lot of folks were still sort of in the process of either hiring supervisors, or in some cases, they were planning to contract out to other agencies to do the hiring of CHW, so they just weren't sure yet. This is a lot of numbers, and we'll share the slides with you. I'm not going to go into all these details here, but we asked about what populations would be supported by the program. And I'll just highlight a couple things. One is that almost 90% said that they would be supporting people from racial or ethnic minority groups. 88% said they'd be working with folks with a chronic health condition. And that really is not surprising and fits right along with what we know about groups that were most heavily impacted and continue to be most heavily impacted by COVID and its aftermath. We also asked about interest in receiving or sharing resources related to other languages, knowing some people might want to receive resources, but some might also have great resources that they want to share with other programs. And so 78% of those who answered this question had some interest in sharing. So they were interested in sharing or receiving resources in Spanish. And then we had several other languages listed as well. We also asked some questions, as I'm sure those of you who completed this survey probably recall, about what sort of topics have been planned to do CHW training on. And so we asked about a few different things. So we asked about whether programs already had some sort of in-house training that they could offer, which is what you're seeing right here in the middle column, versus whether they had an outside resource, so some other organization that they collaborate with to offer training on any particular topic. So what we see is that about almost 80% we're planning to do some training on motivational interviewing, and then just over 3/4 are interested in we're planning to do some training on social determinants of health and things like health conditions management. And then the percentages just sort of go down from there when we think about enrollments in social assistance programs, CHW core competencies, partnerships, and other important CHW topics. We asked about a whole host of topics, as you could see. Again, I won't go into all the details, but this is sort of a descending list. And we found that the percentage that was the lowest in terms of planned training was on monitoring and evaluation. So just under 50% plan to offer CHW training in those areas. Which fits a little bit with what we saw in some of our other results around CHW plan roles. And then we also asked similar questions about desire for help with CHW training. So whether folks wanted us to help them develop a specific curriculum or just wanted an outside resource for training. And what we found was that folks are most interested in help with training on CHW leadership and monitoring and evaluation. So that kind of makes sense that if folks weren't planning to train on those topics themselves, that they would want some support with that. And again, we asked about a whole bunch of topics. We found that folks were not particularly interested in helping with training with things like motivational interviewing or social determinants of health, because those are the things that they were already planning to train in. We also asked about how helpful various types of TA would be on a scale of 1 to 5, 1 being the least and 1 being the most. We found that programs are most interested in having CHWs attend training sessions with CHWs from other 2109 programs and participating with learning communities as well. We asked about specific types of training that 2109 programs would be interested in receiving. Again, 1 is sort of the low number, not at all interested. 5 is extremely interested. And we found a mean that was pretty high. So, lots and lots of interest in issues like financial sustainability for CHW positions. So it seems that programs are already thinking about how they can make sure CHWs deployed after the program ends, promoting CHW workforce retention, CDC data collection and reporting requirements, promoting self-care among CHWs was high on the list, as well as best practices for advancing state or local policy to support CHWs. Let's skip through that. We also asked a little bit about just sort of general perspectives and familiarity with CHW resources. And here, the smaller number you find, the more strongly programs agree with these statements, but really strong agreement that community health workers should be involved in developing training curricula, that the programs are designed to make sure they're culturally responsive to the communities that will be served, high confidence in the program's ability to identify and employ CHWs that are trusted by their communities, belief that CHWs should be involved in training facilitation, and then also plans to use a racial equity lens. Let's skip through some of these. And then finally, we asked specifically about how CHWs had been involved in program development so far, just thinking about wanting to encourage CHW leadership and participation. And we found CHWs were most involved in things like developing partnerships with other organizations and identifying populations to be supported by the program. But on the whole, CHWs were not very involved in things like developing budgets. So only 3 programs said that CHWs had been involved in that, and only 8 said that CHWs had been involved in writing the funding application. And I should point out that only 40 programs in total talked about CHWs being involved. So several programs didn't have any CHW involvement at all. The good news is, as we all know, for years 2 and 3 of the program, there are opportunities to submit the continuation applications. So we really want to encourage programs as they're moving forward with their year 2 budgets and work plans to make sure that CHWs are involved in developing those. I'm going to skip a piece about evaluation and just move right on to the interviews because we're running a little short on time. In addition to our survey, we also did some rapid assessment interviews. Just basically, we tried to find a nice cross section of folks throughout the country who are running these programs. And when I say country, I also mean territories and tribal nations. So we did 1-hour Zoom interviews with a few really fantastic programs that were kind enough to talk with us. And I was really lucky to do those interviews. If you're thinking about asking me who participated, it's top secret. I promised our participants that they could share and remain anonymous, so that's what happened. But what I can tell you is that we talked to a total of 10 grantees. 6 were from component A, 3 component B, 1 B and C. The reason that we had a few more component A is just simply that there are more of those programmatic types. And we got 4 local health departments, 3 tribal programs, 2 state programs, and 1 territory, and then a pretty nice geographic distribution throughout the United States as well. And we were able to get a mix of programs that were very different in terms of people who are working in urban and rural contexts. Some were working with populations that were very geographically dispersed. Some served urban and rural, and then programs working with a wide variety of populations in terms of race and ethnicity. So some of the things that we found really interesting were that programs just really have a wide variety of expertise and experience. So just everybody's kind of starting from a different sort of a different starting place. So you can see these little graphics are sort of intended to illustrate this idea that we're sort of moving along, but starting at different places. So some of the 2109 programs are brand new to working with CHWs. Many more are well established. And one of the things that we were curious about was sort of how everyone has experienced, if at all, sort of accessing best practices and resources in the CHW world. So we talked a lot about that and found that a lot of the people that we interviewed were not familiar with or only kind of vaguely familiar with some of the kind of national resources like the Community Health Worker Core Consensus Project, the CDC funded Common Indicators Project, the National Association of CHW's Document Resource Center. And even those programs that are more well established sometimes weren't super familiar with those resources. So we know that there's an opportunity there to make sure that folks learn about that. We also asked questions about program design. And we were really interested just to learn a little bit more about what the programs look like. So what we really saw is that there are a lot of different paths to achieve the sort of overall goals of the CCR program, but different ways to get there. So generally all the programs that we spoke with involved training and hiring CHWs, not surprisingly, but folks described a lot of different partners that they're working with. So people are working with a lot of different types of local community-based organizations. Some are working with local health departments, sort of collaborations across departments, a lot of university-based partners, largely for evaluation. There was a wide variety in terms of whether programs are connected to existing CHW networks, training programs, or other professional development efforts like credentialing. We found that some groups were not connected to CHW organizations even when they existed locally. So that seemed like an opportunity for sort of further engagement. And we also found that there was kind of a lot of interest in establishing new CHW networks and groups. Sometimes folks talked about really focusing on developing CHW networks for CHW themselves, as well as larger sort of coalitions with CHWs and other types of stakeholders. So that was interesting. And also a lot of variety in terms of how CHW roles were described. Some really intended to focus their CHW efforts on vaccine outreach. Some seemed a little bit more clinical in terms of their services. Some were interested in having CHWs work on doing individual assessments for social determinants of health, while some were also focused on developing community coalitions to address sort of the root causes of health inequity. Overall, I would say that the way that folks described CHW roles was not totally in line with the quantitative data that we had in terms of the C3 roles. So it seems interesting. It seems like programs may not have the capacity to support CHWs in doing all 10 core roles at this point, but that's certainly something that we can try to help with. We heard a lot about program implementation challenges, and I'm sure that many of you are experiencing these on a day-to-day basis. But we learned that a lot of health departments have to go through really complex legislative processes, both to request and even accept funding. And they said that these processes have delayed and will continue to delay the project. And they asked that CDC staff do their best to be understanding of these delays and things that are beyond their control. Lots of talk about COVID itself as a challenge in terms of staff burnout and turnover, people being out sick, and constantly having to sort of adapt their programs. And one person that I spoke to talked about having to pivot every 2 weeks, sort of based on, keeping up on changing circumstances and information, and just talked a lot about the challenges that constant pivoting creates. And then hiring. So folks talked a lot about challenges and delays in finding qualified people, not only CHWs, but also people like program managers and supervisors to help run and implement their programs. And then finally, the last piece that I will note is we asked, of course, about interest in training and technical assistance. And so one of the things that we heard loudly and clearly from interviewees is that every single 2109 program that we talked to said that they were explicitly interested in participating in some kind of learning community or community of practice. They really want to hear what other programs are struggling with and what promising strategies other programs are implementing. Basically, everyone we talked to said they wanted to know about the results of the rapid assessment. So one of the reasons that we're doing this webinar today is we wanted to give these results back. We also heard a lot of interest in learning about promising practices for hiring, supporting, and supervising CHWs, just sort of the beginning pieces on kind of nuts and bolts of getting programs up and running, which made a lot of sense. And then some also asked if presentations and trainings could be made available to other CHWs and other organizations that are not explicitly funded by the 2109 program, but folks that they work with or otherwise allies. So that was an important piece. And then finally, grantees talked a lot about being interested in finding effective models and CHW-friendly systems of data gathering and tracking in order to document their activities. A lot of programs talked about having really good data access within their health departments. So they work closely with epidemiologists, and they often are using data to support and inform their program activities, which is great. And then for some of the grantees, they really talked about the importance of collecting data to be able to demonstrate the value of their programs, demonstrate outcomes, which they believe ultimately will help contribute to financial sustainability of their programs. All right, and so that is a lot of talking. So I'm gonna hush now, and I'm excited to hear about questions later, but I'm gonna turn it over to Leslie Wolf and Andrea Hayward to talk a little bit about how we're now implementing technical assistance and training sort of in response to some of the findings from the rapid assessment.
Thank you so much, Ashley. So we will, everything that you just saw and learned about in terms of what showed up in the rapid assessment really informs what we're going to cover with you. So I'm Leslie Wolf. I use she, her as my pronouns. I'm a longtime CHW ally and an organizer by trade and also in my heart. And I am part of the Envision staff. So what we're going to talk about is Envision training and TA, and the Envision training and TA process is really framed from an equity lens, not just in terms of successful CHW program implementation, but also in centering and uplifting the expertise and experience of CHWs and communities served. So today we'll provide a really brief overview of training and TA support as part of this work and what you can expect moving forward. And so you can see these are the core elements that we're going to review. All of our training and TA approaches are informed by the rapid assessment and will be further refined through input of the CHW Council, the Envision staff, and partners and iterative feedback from all of you. So input will be used to shape timing of engagement, delivery of asynchronous and synchronous training. So we really want to try to offer things that meet folks where they're at all points. And also we'll be identifying specific topics for communities of practice and doing some mentor matching across grantees for peer-to-peer learning opportunities. So the approaches here are monthly COVID webinars, training to support CCR recipient 2109 notice of funding opportunities or NOFO requirements, community of practice, the community of transformation, CHW coaching, and responsive TA. So I'll start by, if you want to advance, thank you. I'll start by just doing a quick description of monthly webinars. Some of you may have already engaged in this. We sort of hit the ground running with this, this offering right away in December. So the Envision approach is really to support participants to obtain the necessary knowledge and skills for an equitable and effective CHW workforce response to the COVID-19 pandemic through accessible monthly webinars that are responsive to the current context of the work. In addition, Envision will support quarterly peer-to-peer learning collaboratives for CCR recipients and CHW subject matter experts to facilitate dialogue about specific topics that emerge from interactions with grantees as areas of need. So for example, this Thursday is focused on CHW referral documentation. And then we have the NOFO part of this work. So we'll provide training support to CCR recipients focused on NOFO requirements. And this is really responsive to topics identified in the rapid assessment and on AMP. So Envision is developing a resource database to connect you to training opportunities. And the CHW Council and Envision CHW partners will review resources with consideration of reliability, usefulness, accessibility, and equity. And if there's not vetted existing training, Envision will work with partners and subject matter experts to develop trainings. And then we have our community of practice. So in collaboration with the CDC, Envision is developing a community of practice approach that includes peer-to-peer learning spaces that are responsive to specific needs, topics, focus areas, and/or populations. And we imagine that these could be really timed at any point. So they could come up as need arises, or it could be something that we start to sort of plan in advance based on trends that are showing up. And the idea is that we'll provide a learning container along with facilitation guides to encourage shared ownership and leadership of the community of practice space. And then finally, we have Envision's Community of Transformation, which will support community-based teams in building the skills and partnerships to establish and lead an aligned agenda for sustaining the CHW workforce. So this training component is probably the most involved of our training spaces before we start to talk about coaching. This is really working through a particular curriculum. If you advance the slide. Envision's Community of Transformation will really be providing a community of practice container focused on sustainability, and through cohort-based learning, will move participants to take collective action. And Each participant really comes to CHW work with distinctive experiences and perspectives. And we want to build on those through an accessible curriculum that includes coaching and training to support community-based teams composed of 2109 recipients, CHWs, and community partners in building the skills and partnerships to establish and lead an aligned agenda for sustaining the CHW workforce. In collaboration with the CDC, CHW coaches, and the CHW Council, we imagine that participation will be determined in year 1 and implemented in year 2 and 3. If you want to, thank you. So the community of transformation is really focused on strengthening collective leadership capacity of the CCR recipients and the CHW workforce to create partnerships, policy, and system changes that ensure every community reaches its full health potential. And this means building skills and engaging with community from the beginning, exploring root causes, thinking about how to create sustainable change, developing a collective action plan, and building strong multi-sector partnerships. This is really drawing on a lot of the different components that showed up in the rapid assessment and pulling them together in a comprehensive curriculum based on organized people, resources, and narratives with power at the root to build a responsive and resilient CHW workforce. Some focus areas are really expanding from social determinants of health and health equity to focus analysis and interventions on societal structures with attention to systems of power and shifting power to sustain the CHW workforce. Collaborative leadership and community organizing approaches that work in coalition to build relationships and intentionally engage and build power with those most impacted by inequities, to use a combination of approaches to sustain the CHW workforce. And then narrative and story, where teams are using strategic communications to elevate community voice and address public solutions to sustain the CHW workforce. So a lot of sustaining the CHW workforce there. And with that, I will turn it over to Andrea to talk more about CHW coaching.
Thank you so much, Leslie and everyone. This is the last slide. We want to ensure you have time for questions and answers, but definitely am so excited to be here with you all this afternoon to talk about our coaching approach. So my name is Andrea Hayward. I'm a community health worker and a part of the Envision team. I am a staff member at this Center for Community Health Alignment, who serves as the lead TA provider for this particular initiative. We have a long-standing history of working with organizations on the community health worker model, in addition to equity and meaningful community engagement. And so, as Leslie stated earlier, our approach really is framed from an equity lens, really uplifting the expertise of individuals with lived experiences, community health workers, and community health worker allies in the field. This approach is very much so relationship-based. And as we've learned a lot today about what we've seen through the rapid assessment, really utilizing that information moving forward to help inform how we can best support you and your progress as a part of this work. Next slide. Awesome. And so some of the core components that we really want to share as opportunities for technical assistance is the development of individualized technical assistance plans. So really looking at your individual rapid assessment results and also your experiences from that point and seeing how we can best support you in moving forward. That includes ongoing coaching support. So as we talk about uplifting community health workers, our coaching team, our community health workers with various experiences working in the field who will be available to support you along the way. In addition to this, working with community health worker subject matter experts to provide mentorship opportunities and also continuing to connect to resources, training opportunities, and other subject matter expertise along the way as well as core components of this work. Next slide. And so as we continue to move into our what's next, We are looking forward to meeting with each of you starting in April as a part of the community health worker coaching team, really having some intentional time to review rapid assessment findings, developing goals and action steps specifically for technical assistance to support individual 2109 recipients and partners, and also looking forward to ongoing collaboration. As I mentioned earlier, we're really focused on relationship-based interactions. And so having collaboration between community health worker coaches to continue to monitor and support progress. And again, having those connections to subject matter experts for additional coaching support, mentorship, and resources. Next slide. So for immediate needs, some of you have already utilized AMP to submit TA requests. We ask that you continue to do so as a part of our process and working in collaboration with the CDC, staff, and subject matter experts. We are really looking forward to continuing to meet those needs through TA requests submitted in AMP. And this process is very much so the same of working collaboratively to ensure that we're meeting your needs. And so our coaches will be a huge part of this component in ensuring that we're able to monitor and continue to update TA action plans as needs arise. And so with that, I'm going to shift over so that we can have some time for question and answers.
Right, everyone. Thank you, Leslie and Andrea. So at this time, it is time for question and answer. So if there is anyone that wants to come off mute, or we'll go back through the chat as well too, to look at any questions that did come up. But it's why we're looking and going back through those. If anyone does want to come off mute to ask a question for any of the presentations that went on, you are definitely able to do that. Someone asks, what is AMP? And it's not a silly question. It is okay. If someone wants to answer that.
Yeah, not a silly question at all. So AMP stands for Awards Management Program, I think. Someone help me. Platform. Thank you. And it is the interface. It's the space where 2109 folks and 2110 folks are able to interact with each other. So it's a space to get resources, to be able to make some requests for training and technical assistance. It's also the platform where we upload things to the CDC, so report back, and also where the CDC can send things back to us. Anyone else have a better description on that? That was my back of the envelope. This is what AMP is.
Yeah, Leslie, I'll just add one other thing to what AMP is that AMP is used to manage the award for the 2109 recipient, who's the direct recipient. So if you are not the direct recipient, don't be surprised if you haven't heard of it or that you aren't familiar or aren't on it. And that's why we have dually available our information both in AMP for those that have AMP assets, as well as through the Envision listserv. So if we could drop the listserv link into the chat too, that would be helpful, because you can also access our slides and our information both ways, because we want to make sure we stay equitable and getting that information out in as many ways as possible, as you all had requested in the rapid assessment, that we're wanting to make sure that good information gets out there. Thanks, that was a great question.
And I think there's another one from Camilla. If we are interested in the coaching collaboration that was mentioned in the last slide, should we submit requests in AMP, or will Envision be reaching out to the grant recipients?
Andrea, you want to take that one?
Yeah, and so that is a great question. And so our goal is to reach out to all grant recipients starting in April to start some initial meetings, and also to identify if there are any partners that we also need to collaborate with as a part of technical assistance and coaching. And so, yes, we'll have our coaching team reaching out. However, if you do have an immediate need, we do have the Envision team available and already responding. And so you can, if you're not a 2109 recipient, work with your direct partner to get those requests in, but we are really excited to be able to get out and speak and learn more about what you do and collaborate. So yes, coming very soon.
Awesome. Yes, and I didn't see any other questions in the chat. I think the one about the presentation got answered. So yes, they will be available in many platforms. Well, yeah, I don't think so I'm not seeing any more questions, and I don't know if one wants to come off mute, but I think we're probably good on questions then. And yeah, so just to wrap up and kind of reiterate some of the stuff that we've been saying. So once you do close out of Zoom, there will be like a satisfaction poll and some instructions for that. Pretty much you will be prompted for a survey, and your feedback is absolutely important to all of us at the team and helps us tailor this time to best support your work. So please take a moment to fill that out, and that will be prompted as soon as you do close out the Zoom as well. And our next webinar is this Thursday, March 24th. And once again, if you are interested in any TA and technical assistance requests for 2109 recipients, you are able to do that through AMP, as well as opting into the listserv, which that was dropped in as well. And all this information will be dropped in the chat before we close out and things like that. And all the materials will be sent out in a follow-up as well. And besides the webinar on the 24th, there will be one coming up in April. And yeah, and we just want to thank all of you for participating in this, as well as thank you to all the presenters and giving some awesome information on TA and the rapid assessment. And yeah, just thank everyone for coming.